Can progressive supranuclear palsy be misdiagnosed? Can progressive supranuclear palsy, often called PSP, be misdiagnosed? This is a significant concern in the medical community. PSP is a rare neurodegenerative disorder that can be quite tricky to identify correctly. It shares many symptoms with Parkinson's disease, such as tremors, stiffness, and movement difficulties. However, PSP has unique features that set it apart, like challenges with moving the eyes vertically and a tendency to fall backward. Misdiagnosis of PSP is relatively common. Many patients initially receive a diagnosis of Parkinson's disease or other similar conditions. This happens because the early symptoms of PSP can closely resemble those of Parkinson's disease. The distinctive features of PSP may not be obvious right away, making it harder to identify. Moreover, there are no specific diagnostic tests available for PSP, which complicates the situation further. The clinical presentation of PSP can differ from person to person. To accurately diagnose PSP, healthcare providers often relying on a combination of clinical evaluations, imaging studies, and sometimes genetic testing. The diagnosis primarily hinges on clinical criteria, which include specific symptoms like vertical gaze palsy, postural instability, and cognitive decline. In the context of Parkinson's disease, understanding these diagnostic challenges is crucial. While both conditions involve motor symptoms, their underlying causes and progression are quite different. Getting an accurate diagnosis is vital for determining the right management and treatment plan, since the approaches for PSP and Parkinson's disease can vary significantly. For individuals suspected of having PSP, a thorough evaluation by a neurologist, particularly one who specializes in movement disorders, is essential. This evaluation typically includes a detailed medical history, a physical examination, and possibly imaging studies such as magnetic resonance imaging to rule out other conditions. Recognizing PSP's unique features early on can help prevent misdiagnosis and ensure that patients receive the most appropriate care. In summary, while progressive supranuclear palsy can indeed be misdiagnosed, awareness of its symptoms and thorough evaluations can lead to more accurate diagnoses. If you or someone you know is experiencing symptoms, consulting a healthcare professional is the best course of action.